Welcome to this module on working with the private sector. In it we discuss why private companies and individuals should be involved in delivering sanitation services, models for structuring their involvement, how to attract them, building knowledge and capacity, and elements of a supportive, legal, regulatory and policy environment. So why should we look to the private sector to improve sanitation services? Firstly, in many situations, like you and your company, they're already in the sector and responding to demand, either formally or informally. They have a direct incentive to work because they get paid when they deliver. The main rationale for involving the private sector is to increase efficiency under the discipline of the market. Hardware merchants, masons, vacuum truck operators, stock materials, build toilets and empty septic tanks in competition for consumers. And enterprises providing downstream services such as fecal sludge treatment or sewage management compete for contracts. At the same time, they're adaptable, willing to stock new products, expand their range of services, and serve new areas to meet changing demand. The private sector mobilises additional capital and capacity. This means providing equipment, tools, materials, and investing capital with individual or company profits, savings and loans. Private sector expertise, experience and staff add to the sector's human resources. However, a completely free market doesn't necessarily guarantee quality or goods and services at the prices that are affordable to the poorest customers. Quality and subsidies are discussed in the modules about regulation and financing. There are three main ways to involve the private sector. Firstly, the free market. This operates informally in the absence of rules or regulations, or where they are not applied. Informal does not necessarily mean it's illegal. The free market can be regulated by applying conditions, such as using a designated fecal sludge disposal site and a licensed tanker. The licence may specify health and safety standards, approved equipment, etc. However, prices won't be regulated, so the poorest customers are still unlikely to be serviced and will resort to cheaper, poorer quality services. Secondly, a restricted market of approved service providers. An output-based agreement could permit the provider to work if specific outputs are delivered and conditions are observed. A franchise assigns the provider to service households in a defined area, as is quite common for solid waste collection services. Lastly, there are various public-private partnership models where the provider delivers services on behalf of the public authority. Performance-based contracts, sometimes known as service-level agreements, should be used. These can apply to a range of models, such as a concession, where the provider delivers and expands the service using public assets, or a lease, where only the capital is invested by the public authority, or a management contract, where staff and consumables are provided, or a service contract, which provides a part of the overall service. These models represent decreasing levels of autonomy for the service provider and increasing levels of quality and price control by the sanitation authority. Private sector participation models depend on the type of service required. Licensing, franchising and service-level agreements are suitable for customer-facing services, while lease or concession agreements are a better fit for downstream services, such as sewerage and fecal sludge treatment. Who is already in the market? What is their capacity to participate and expand? Or will new service providers need to be developed? This picture shows a performance-based contract being signed by the Kutibari Cleaners Cooperative and Faridpur municipality in Bangladesh. Their contract specifies an improved quality of service and safe disposal of sludge. Other considerations include: how will the service be paid for? Will the household pay the full cost directly or via a utility bill? Will subsidies be needed? Or will the public purse pay for the services directly or through a sanitation tax? Finally, what capacity and incentives exist for effective regulation and supervision? Reach out to the private sector. Hardware suppliers, toilet builders, pit and septic tank emptiers, public toilet operators and others, formal and informal, people who are already providing sanitation services. They know the business and they can contribute a lot to developing better services. Some, like manual emptiers, may be hard to find and reluctant to trust you, but listening and patience will pay dividends. This has been done, for example, in Bangladesh and Kenya. A branded promotion campaign, such as the Sweet program in Dhaka, will help promote approved service providers. When you do this, work with professional communication and marketing agencies for an effective campaign. Many FSM programs report that formalisation brings increased status and encourages investment in the business. Clean, smart uniforms and personal protective equipment increase the workers' pride in what they do and bring social acceptance. For households, one-stop shops, which offer a package of hardware, services and credit for people wanting hygienic and easily emptiable on-site facilities, have produced good results in Peru, Indonesia and in other countries. It's important to plan programs to build the technical and business skills of service providers. This should include training and peer-to-peer learning and facilitating access to capital, equipment and joint marketing initiatives. Where there are many service providers, for instance pit and septic tank emptiers, it's useful to promote the establishment of a trade association where there isn't one already. This will facilitate communication and help sort out detailed arrangements. As an example, training was offered to septic tank and pit emptiers by the Kampala Capital City Authority in Uganda in 2018 as part of a citywide sanitation programme. About 25 tanker owners started the training course, but word spread and the numbers increased, and 120 people attended the final session. Vai is a small town in Maharashtra, India. The political and administrative leadership has promoted non-sewered sanitation and helped to legitimise the private sector engagement. As part of this, Vai Municipal Council established a service contract with the private sector. It included scheduled and emergency emptying of 2,000 septic tanks per year for 3 years, safe transport and disposal of sludge at a designated site, and promotion of the service and setting up a control centre. The service provider is paid a monthly fixed amount on achievement of targets, and the households pay for the service through a sanitation tax levied by the municipal council. The service is verified at the points of emptying and disposal to avoid indiscriminate sludge dumping. The vehicles are tracked using GPS, and the service provider reports to the municipality, which also carries out the inspections. As the examples show, policy, legal and regulatory systems are needed to support private sector involvement. Firstly, work with the private sector, don't threaten their business. Whether formal or informal, you need them, and they'll welcome increased business opportunities. They're often eager to invest when a revenue stream can be predicted and expanded. They need to understand the legal and regulatory systems and which institutions are involved. Government procurement processes may be complex and unsuitable for small, informal businesses who have little experience with bidding. You may need to adapt the process or help them prepare their bids. If the private sector perceives too much financial risk in the proposed model, you could consider partially guaranteeing their income, maybe for the first few years, until they have more confidence in the market. Base new regulation on reality and make incremental improvements over time, say over 5 years. Finally, be realistic about what can be supervised and enforced. Many small-scale private operators will need support while the market develops. This could include demand generation through promotion campaigns, facilitating their access to treatment and disposal sites, or technical assistance to join a procurement process. Regulatory action can improve containment standards, phase out unhygienic manual emptying, ensure safe disposal of fecal waste, and license certain hardware products. This can improve sanitation while also helping to generate business. In this module, we have learned that the private sector is a motivated, agile partner in delivering sanitation services. They can deliver through different market and public-private partnership models. The appropriate model will depend on the type of service, the local capacity, and the incentives that exist to supervise contracts and enforce regulations. In many situations, pull factors and capacity building for the private sector will be needed, alongside realistic, supportive policy and regulatory systems. Thank you for watching.